Along those lines, Scott and I were talking during the week about a sideline observation that he made. Scott, you want to tell him?
Yeah, this was fascinating. Last week, like a lot of the rest of us, I was glued to my chair watching football. And I've also discovered this really cool invention called Twitter. So I've learned how to tweet. And so I'll sit there and tweet and Facebook and all the social media stuff that people 20 years younger than me, that's their language. And for me, it's not. But I'm watching the Ravens-Steelers game. And towards the end of the game, Roethlisberger takes this hit, and his head hits the ground, and you could tell that they're going through the concussion protocol. They call a timeout just in case he passes so he doesn't have to come out of the game. Well, it turns out even with the timeout, they take him out of the game. I guess they check him. Somehow he passes the concussion test. He comes back, and his first pass back just throws an interception just directly to the Ravens linebacker in the end zone. So he's on the sidelines after this, and they keep showing him, and his helmet's still on, not unusual, but his chin strap is in his mouth, and he's got that glazed look in his eyes. And so I tweeted or Facebooked or whatever, said, I don't think Roethlisberger's going back in. He's just not right. And then the next series, he's back in, and I'm on the phone to Tio's, like screaming, like, there's just no way. The guy couldn't even get the chin strap out of his mouth with glazed eyes, and there's no way he passed those concussion tests.
So we've often said on the air that the sideline eval is one of the most difficult aspects of sports medicine, whether it's a sideline of a football game or in hockey or in basketball on the court. These are difficult evals to do because the conditions are less than optimal. You know, there were some issues, or there were some questions a year or two ago about RG3 and his knee and the sideline eval, and should he have gone back in? Should he not have gone back in? And I remember watching that game. It was a mud hole. It was just terrible conditions, and we don't have X-rays, we don't have MRIs, and we being the medical staff are trying to make a call whether to put the player back in the game or not. And it's difficult. I'm going to tell you right now, it's a very difficult call. Interestingly, the person involved in the RG3 call was none other than Dr. James Andrews, the biggest name in the world of sports medicine. But listen, your point about Roethlisberger and that glazed look, you can see it. You can see it even on television. And
no question. But you're being very diplomatic. Why don't you? Did you want to say what you said to me when I told you this?
Well, you know, it's again, you have to be aware of the current conditions and the importance of the game. And I don't know what the NFL is doing now. I'm not an NFL sideline doc, so I don't know. But I do think that there's a neurologist that has to be present at games, that has to clear players. I don't know exactly what the current protocol is, but there are steps in place to protect the athletes. However, we're going to go back to that risk-reward equation that I've talked about for the 15 years that we've been on the air. There is a risk-reward equation that we go through when we determine whether to put a player back in the game or not. And this risk-reward equation is a rule that I have lived by, whether it's high school, junior high, pee-wee, pro, Game 7 of the Western Conference Finals, et cetera, et cetera. In a preseason game, given the same set of circumstances, the athlete probably would not come back. In the Super Bowl, yeah, probably. Now, there are a lot of factors that go into this. We're going to talk about them a little bit later because I did touch base. I did touch base with one of my upcoming guests about this exact subject, and there are a lot of factors that go into whether he should return or not. And given what was at stake, I'm not surprised. But I'm sure that they went through the appropriate steps, and did he ultimately come back in the game?
Yeah.
All right.
I mean, in the next series.
Yep.
I mean, he was really out for maybe 2 or 3 plays.
855-787-1033 and 64636 is the text machine number. You can start off with the letters ESPN. Couple of text questions coming in. It's hard for me to